First off, Jo, can you just introduce yourself, please?
Yeah, my name's Jo Griggs. I'm a paramedic working with air ambulance charity Surrey, Sussex.
And what is it like working as a paramedic in an air ambulance?
I think one word that comes to mind is a complete privilege, really. So we have such a broad spectrum of professions within our team, varying from the fundraising aspect all the way through to the dispatchers, through working with other clinicians in various professions. To come together as a team like that and have that variety and do the job we do really makes it quite special.
And what is the most rewarding part of your job?
Well, the most rewarding part, I would have to say, is on occasion we have patients and families who, through our aftercare service, are brought back to us at times on base to chat through some of the jobs that we've maybe been out to attend them. And that's incredibly rewarding because we can hear about how their story has progressed and how potentially our various interventions and various treatments on scene have been able to support them within their recovery, whether that be go back to work or, over the next couple of years, support them in their lives.
And is there something about your job that people might not know?
I think there's probably two elements to the paramedic role, which specifically and across the team really, which are probably less discussed. And one of those is we are continually driving to improve our service. One aspect we do that is through education and training. So if we're not seen in the air, out and about, doing our role, then a large proportion of our time is actually on the base, working through different systems, different processes, trying to improve the level of care that we give, both with regards to our treatments and also improving and making our system more efficient. And the second element we do that is that we look at a lot of data. We look at a lot of how our performance of previous years, and we look at a lot of previous cases and really try and work down how we can improve our timelines and improve our sort of patient care from that angle. And that is quite a big role within the paramedic job and with other multiple professions within the service to improve that.
Do you have any advice for someone who wants to become a paramedic?
So two parts to that. So I think certainly from the paramedic side of things, I think it's quite competitive these days. So I think the earlier you can certainly gain your sort of academic qualifications to get to that position, that's a really good place to be. And then second to that is really building on the aspects of the job that you'll use the most. So most of the role is being out in the community. It's understanding the needs of our community and how we can provide that care. And some of those opportunities come from working within different voluntary sectors within the region. That might be one route in. And then really having a mentor, really having someone who's been through the process. And our profession, certainly as a paramedic, has changed hugely in the last sort of 20 to 30 years. So perhaps having somebody who's recently been through those changes and seen how to progress academically, seen how to progress within various services. To answer your question around becoming a paramedic for the air ambulance, it's really a continuation of that. Within the air ambulance sort of sector, we see patients who are at the critical end or have acute medical needs, whether that be through illness or accident. So some of that training, as you bedded yourself in as a paramedic, then should lean towards the kind of critical care aspect, and that will involve further study and further sort of exposure to that level of patients, which really does only come with the level of experience within your sort of regional ambulance service.
And how important is fundraising to air ambulance charities across the UK?
Yeah, absolutely critical. So obviously there's 21 air ambulances across the UK. Fundraising is how we operate as charities. Various ways we as air ambulance charity Surrey, Sussex ask people to get involved, and that's the same nationally. So that money, that funding enables us to run our service, really. It enables us to operate at a level, for us, that's 24/7 hours a day, helps us to reach more patients across the region and really do the job that we're able to do. So thank you.